Hi, I'm Steve Beaudette, cardiologist here at St. Joseph's Hospital and director of the Cardio-Oncology program. I'm going to go over some questions that patients may have about what cardio-oncology is. So what is cardio-oncology? Cardio-oncology is a medical specialty that focuses on the heart and blood vessels of patients with cancer. Cardio-oncologists work closely with cancer specialists to help patients receive the best cancer treatment while minimizing the risk of heart damage. So who decides on what patients should see a cardio-oncologist? Anyone in the patient's treatment team can refer a patient to a cardio-oncologist. Usually this is a cancer specialist, cancer surgeon, primary provider, or other cardiologist. So what patients should be seen prior to starting cancer treatment? Often patients are referred prior to cancer treatment to optimize any pre-existing cardiac conditions like coronary artery disease, heart failure, hypertension, or atrial fibrillation. By optimizing their cardiac conditions, cancer treatment can be better tolerated and safer. Another common cause for referral prior to cancer treatment is to assess and minimize the cardiac risk of cancer surgery. This will involve a detailed history and physical exam. It may involve testing to assess the heart pumping function, valve function, and assess whether significant coronary artery blockages are present. Cardio-oncologists can also help assess the risk of developing heart problems from the proposed cancer treatment and create a plan to reduce complications. So how about during cancer treatment? That's another time when we see patients with in the cardio-oncology clinic. Cancer treatments shrink and kill cancer cells. However, some of them can also damage your heart. The goal is to successfully treat your cancer without causing new heart issues or making pre-existing heart conditions worse. The medical term for this is cardiovascular toxicity. Some of the chemotherapy agents can weaken the heart, leading to heart failure. Others can cause heart rhythm abnormalities, high blood pressure, or reduced coronary blood flow to the heart. So what are some of the monitoring tools used to assess toxicity from chemotherapy agents? Some of the tools we use are echocardiograms, which are ultrasounds of the heart. They can be used to assess the heart pumping function of the heart before, during, and after cancer treatment. We have some advanced echo technology here at St. Joseph's Hospital called strain imaging, which can give an earlier indication of heart damage. In addition, cardiac biomarkers can be used. That's lab work, which can assess for cardiac damage. EKGs and heart monitors can assess for heart rhythm abnormalities. Some immune therapy agents called immune checkpoint inhibitors can cause immune-mediated inflammation in the heart that can be assessed with a cardiac MRI. So what can be done if the heart pumping function is reduced? There are established medications used in heart failure patients that have been shown to help the heart pump stronger. By starting these, we can prevent or reduce reductions in pumping function, allowing continuation of the needed cancer therapy. So how about radiation therapy? How does that impact the heart? Radiation therapy can cause short and long-term cardiac issues. It is an important component in the treatment of cancer, and over time, treatment strategies have been developed to minimize the damage to the heart. Short-term, there can be inflammation of the pericardium, the sac around the heart. Long-term effects can present months to years after radiation therapy, include valve disease, pericardial thickening, coronary artery disease, conduction system disease, and stiffening of the heart. Because of this, patients who receive radiation therapy should seek care for any new or concerning symptoms like shortness of breath, chest pain, dizziness, or passing out. So another question that patients ask is, are there patients that should have ongoing follow-up with a cardio-oncologist after they've completed their cancer therapy? And the answer is yes. So patients that develop cardiovascular toxicity from their cancer treatment, or those at increased risk for delayed cardiac toxicity, specifically those that receive anthracycline chemotherapy agents at an increased dose, particularly if they also receive radiation therapy. In those patients, there's ongoing monitoring to determine if there are delayed cardiac effects from the cancer treatment that would require therapy. Studies have shown that cancer survivors have a greater risk of developing cardiovascular disease. Preventative measures that are important for all of us are even more important for cancer survivors. So these include abstaining from tobacco products, getting to and staying at a healthy weight, getting regular exercise, with the American Heart Association recommending at least 30 minutes 5 days a week, and eating a heart-healthy diet like the Mediterranean diet. And also regularly seeing a provider for checkups with evaluation of blood pressure, cholesterol levels, and screening for diabetes. So one final thought about cardio-oncology. A really important aspect of cardio-oncology is our close and ongoing communication between the whole cancer treatment team regarding any heart issues that arise, allowing us to prevent or reduce any delays in cancer treatment. So do we have any questions?